Hi everyone, so today we're going to talk about self-care during COVID-19. So there's two categories. First is mental health and physical health. For the physical health, first, make sure you drink a lot of water in a day to make your body feel hydrated. Second, exercise at least 50 minutes a day. Third, eat healthy food and maintain balanced diet. Fourth, at least sleep 7 to 8 hours a day so that your body will feel full energized when you woke up in the next day. And fifth, stay at home. Avoid going out, only go out when it's necessary. For the mental health, first, listen to your music because music helps to soothe our hearts and our mind. Second, try to read books because books will keep you distracted from unnecessary things. Third, reach out for friends or family if you feel lonely. Talk to them. Last, make yourself busy. Do your house chores, your assignments, or anything else that you find helpful for yourself. So thank you.
Quarantine is a way to separate and to restrict movement of someone who may have been exposed to the virus to check if they become sick. Who should quarantine? During an outbreak of a highly contagious disease, public health recommendations can change from day to day. The KKM recommends self-quarantine if a close contact of yours has confirmed case of COVID-19. A close contact is someone who lives in your house, your friends, and your family. How to self-quarantine? Usually, any symptoms of COVID-19 appear within 2 days to 2 weeks after an exposure or infections. But many people who get this coronavirus, but some don't have any symptoms. So self-quarantine should last for 14 days to allow time to confirm without testing that you don't have it or can't spread it to the other. During your quarantine, you should stay home unless you absolutely leave, such as for essential medical appointment. Wear a mask if you can't spread yourself. You should follow the same hygiene habit that the KKM recommends for everyone during this pandemic.
You have been tested positive for COVID-19 virus? These are the do's and don'ts that you have to know. First, you have to update your risk management on MySejahtera. This is to avoid any serious illness without the concern from the medical expert. Second, you have to go to the CAC or COVID Assessment Center. This is to know whether you have to quarantine at home or quarantine at the quarantine center. Third, you have to follow all the SOPs that have been highlighted by KKM and government. For the don'ts, you cannot go out from your home if you have been quarantined at home. This is to avoid you to spread the virus to other people. Second, you cannot take any medication without a consent from the medical expert. Last one is, don't be silent if you have a short of breath. Get your medical expert and contact them. That's all for the COVID-19 patient, and hope you follow all the do's and don'ts that I have mentioned before.
Patients on home quarantine must be contactable at all the times by phone. They must be able to maintain at 1 meter distance from other household members and use separate eating utensils, tableware, towels, and bedding. Ideally, they should quarantine in a separate bedroom with an attached bathroom that's not shared with other household members. Home patients are required to wear face masks around their family members and to wash their hands regularly with soap and water for at least 2 minutes, or use a hand sanitizer. Importantly, patients must be responsible for their health status every day on their MySejahtera app and monitor their symptoms closely. According to guidelines from the MOH, COVID-19 patients will receive their vaccination appointment while still in recovery should reschedule their appointment by cancelling it via the MySejahtera app. A new appointment date will be given within 30 days. Vaccinations should be deferred until the patient has recovered from the acute illness. If symptomatic and if they have met the criteria to discontinue isolation as set by MOH. Thank you.
During this pandemic COVID-19, we need to know about the 3 C's and the 3 W's. The important thing is we need to avoid the 3 C's. What is the 3 C's? The 3 C's means crowded place, confined space, and close contact conversation. First is crowded place. We need to avoid that with many people nearby. Second is close contact setting, when people are not ventilation. Third is close contact setting, especially where people have a close range conversation with you. Also, the 3 C's risk is higher in places when this factors is overlaid. Even our restrictions are lifted, consider where you are going and stay safe by avoiding the 3 C's. But also, you need to know that you have to practice the 3 W's. What are these 3 W's? First is wash your hand frequently. Second is wear. Wear your mask whenever you go out. Third is warn. Example, practicing your cough and squeezing in etiquette way. Also, do not shake hand or touching with anyone you know or don't know. In any ways, you must also sanitize your home, your car, and yourself. If you're not feeling well, get a treatment if the symptoms occur. I would like to spread awareness about the COVID-19 to all of you. We are together to break the chain of COVID-19. Stay safe, stay at home, and stay healthy.